Yes, so once again, good evening. Thank you so much for making time to join today's webinar on the medical labs run before you say I do. If you are joining us for the first time, this is Ghana Canada Medical Center. We are located at East Legon or in East Legon at Dringano off the Trasacco Road. And our services include general medicine consultation, pediatrics, obs and gynae, ENT, urology, cardiology, internal medicine. We also do surgery. We have a pharmacy, we have an ultramoderate lab. Also, we do dialysis. And every month, we bring you insightful webinars on health topics. And for this month of February, it's very wise to bring you a very educative one on the medical labs to run before you say, I do. And before I call the resource person, I would like to say we need to keep our backgrounds muted just so we can hear the resource person. And if you want to put on your video, you want to make sure the background is very clean and very safe for us to, consume. If you have a question, you can either raise your hand to be called, or you wait until the speaker finishes and then you'll be called to talk. You can also leave your message in the chat box and then we'll attend to you accordingly. So without much ado, I would like to call our lab manager, Dr. Shanthi Akomeah, to take us through the medical labs to run before you say I do. Thank you very much and enjoy this session. Dr. Akomeah.
Yes, ma'am.
Your audience, please.
Okay. Good evening once again, and welcome to today's webinar. My name is Dr. Shanthi. I'm the lab manager at Ghana Canada Medical Center. Today's webinar is about laboratory tests to run before you say I do, before you get married. It's a comprehensive guide for couples intending to get married. So before we start the presentation, I'd like to give you the outline of what we're going to do. We will talk about marriage, premarital screening, objectives of the premarital screening program, general tests for both the male and the female, explanation of why understanding blood types is crucial, resource factor and its impact on potential pregnancies. We're also going to talk about sexually transmitted infections. We're also going to talk about genotype testing, fertility testing, and we'll conclude. Generally, we all know that marriage is very important in our society and is a fundamental building block of our society. The cornerstone in building emotional, healthy, and family relationships. A healthy marriage guarantees preventing the family members from the hereditary or infectious diseases, thus building a happy and stable family. Healthy marriage is defined as a state of agreement. That is, there should be cordiality, there should be understanding between the couples and harmony. That is peace or a blissful marriage between the marriage partners with regards to their health, psychological, sexual, social, and legislative aspects, aiming at making a sound family and having healthy children. Before you get married, it is very essential to go for premarital checks. Premarital screening is basically defined as testing the couples who are planning to get married soon for common genetic blood disorders such as sickle cell anemia, hemophilia, thalassemia, and all other genetic disorders, as well as infectious diseases, such as the ones I've listed, hepatitis B, hepatitis C, syphilis, and HIV. Premarital screening generally aims to give medical consultation on the odds of transmitting these infectious diseases to your partner or even to your children, and provide your partner or your spouse with options that will help them plan for a healthy family. So we have to talk about the objectives of premarital screening. So premarital screening aims in limiting the spread of these genetic disorders and infectious diseases. It also helps promoting awareness about the concept of comprehensive healthy marriages. It also helps reduce pressure over health institutions and blood banks, and also helps avoiding the social and psychological problems of families whose children suffer from these genetic conditions. Reducing the family and community's financial burden of treating the injured person. That means, imagine you have a child who is sickle cell, you end up spending a lot of money on healthcare, money that you could put together to do other things within your family, you end up spending it on sickness, and you end up buying drugs and all that, which at the end of the day could frustrate you and your partner. The general tests we usually check for in the laboratory are sickle cell or sickling test or HB electrophoresis. That's the common name we give it. We also check your blood type, which we also refer to as the blood group. We'll do a complete blood count, CBC, or other known as a full blood count. Could also check your blood glucose levels. We also screen for sexually transmitted diseases, such as hepatitis B, HIV, syphilis, and gonorrhea, chlamydia. There are a lot of them. We also do a urine analysis. These are general tests we do. We could also do fertility tests. This tests, we run all of them at Ghana Canada Medical Center. So kindly feel free to walk in if you want to carry out any of these tests. We do these tests and more. But then if you have any questions regarding these tests, you can always ask at the end of the presentation. Importance of blood types and resource factor. What is blood type? We'll ask ourselves. Blood types, which is commonly known as the blood group, is classification of blood based on the presence or absence of antibodies inherited. These antigenic substances on the surface of red blood cells, everybody has them. And they are divided, they are categorized into 4 main types. We have the blood group A, blood group B, the AB, and the O. Your blood group is usually determined by the gene you inherit from your parents. And each of these can either be resource negative or resource positive. What do we mean by resource negative or resource positive? The resource factor is also determined by a pair of genes you also inherit from your parents, but it's different from the ABO type. Your blood can either be resource negative or resource positive, depending on the certain molecules present on your red blood cells. And a person with a negative resource will experience severe immune reaction if transfused with a positive blood group. This condition, there are certain conditions that could arise from giving somebody a different blood type as to what they actually have. And there are also certain conditions that could arise as a result of blood group or blood type incompatibility. Blood type incompatibility is essential to assess the risk of a condition called hemolytic disease of the newborn, a condition where the mother's immune system attacks or destroys the red blood cells of the baby. This occurs when there is an incompatibility between the blood types of the parents, especially in the ABO and the resource systems. So for instance, if the husband is resource positive and the wife is resource negative, there's a possibility of the unborn child or the child that the mother is carrying to carry the blood type of the father, which is a resource positive baby. And this could cause incompatibility problems. So this is a pictorial depiction of what I was trying to explain. In this picture, you see the father is resource positive and the mother is resource negative. And the child the woman is carrying is resource positive. So a resource negative mother carrying her first resource positive child. So the resource antigens from the developing fetus can enter the mother's blood through delivery, which will cause an immune response. And this immune response results in something we call sensitization. So the maternal immune system, that's the mother's immune system, reacts by producing antibodies that destroy the baby's red blood cell after being exposed to the baby's resource factor. this is also another pictorial depiction. You can see that the mother here is rhesus negative, and the child here is the mother, is rhesus negative, and the child is rhesus positive. And the mother produces antibodies against the baby's rhesus antigens. But then there is something called an injection, which is well known as Rogam, which is usually given to mothers soon after the birth of their child, especially their first child, to neutralize these antibodies. But notwithstanding, it is very important for every individual to know their blood group and ascertain whether they are at risk of developing this incompatibility or not. So once again, rhesus incompatibility is another crucial component of blood types. In rhesus negative mother, if a rhesus negative mother is carrying a rhesus positive child, which I've earlier explained, there's a risk of rhesus incompatibility. This can lead to the development of antibodies in the mother's blood that may affect future pregnancies. Understanding the rhesus factor is crucial in preventing complications and taking appropriate measures to ensure a healthy pregnancy. So it's very important to know our blood group or our blood types so that we know our stand. And when it comes to blood transfusion, it's also essential we individually know our blood types. So in the event of a medical emergency, such as a surgery, or maybe there's an accident, you are losing blood, knowing the individual's blood type is essential to match with compatible donor blood. A mismatch can lead to severe and potentially fatal reactions. Okay, so we are going to talk about sexually transmitted infections. So apart from checking your blood group, you also have to screen for sexually transmitted infections. So sexually transmitted infections are basically infections acquired through sexual activities. The World Health Organization, as the WHO, has listed key general factors we have to know about sexually transmitted infections. And these factors are as follows. More than 1 million sexually transmitted infections are acquired every day worldwide, majority of which are asymptomatic, meaning you might have a sexually transmitted infection and you won't exhibit any symptoms, you won't know. Each year, there are an estimated 374 million new infections, with 1 of 4 incurable STIs, such as chlamydia, gonorrhea, syphilis, and trichomoniasis. More than 500 million people between the ages of 15 and 49 years are estimated to have genital infections with herpes simplex virus. Human papilloma virus infection is associated with 311,000 cervical cancer deaths each year. And last month was our cervical awareness month, and P spoke about HPV and its risk of you developing cervical cancers. And almost 1 million pregnant women were estimated to be infected by syphilis in 2016, resulting in over 350,000 adverse birth outcomes. So you see how important it is to test or to screen for these infections before you get married. STIs have a direct impact on sexual and reproductive health through stigmatization, especially when it comes to HIV and AIDS, infertility, cancers, and pregnancy complications, and can increase the risk of HIV. And finally, drug resistance is a major threat to reducing the burden of STIs worldwide. So these are the key factors listed by the World Health Organization. In screening for STIs, it helps to identify and treat individuals who may be carriers of this infection. Treating infections before marriage reduces the risk of transmitting the infection to your partner during sexual activities. But it is important to also note that if these infections are left untreated, they can lead to serious health complications, including infertility, chronic pain, and increased risks of certain cancers, such as cervical cancer. So these are common sexually transmitted infections. I'm sure we've all come across. And we have HIV, herpes, we have hepatitis B, we have gonorrhea, we have syphilis, we have hepatitis B, and the others. These are also common sexually transmitted. We also have herpes. There are a lot of them, but basically these are most of the common ones we usually come across on a regular. Premarital screening also helps rule out carriers of potentially threatening infectious infections. I've mentioned this earlier, like HIV and hepatitis B. And it is important to also note that hepatitis B is very, very infectious. It is 50 to 100 times more infectious than HIV. And hepatitis B virus can be passed from mother to baby during birth. Therefore, it is important to safeguard yourself from these potentially life-threatening diseases with a simple screen. So our doors are open at Ghana Canada Medical Center. You can always walk in and get screened for any of these sexually transmitted infections I have listed. It is important to test for these STIs because knowing your status is crucial for you and your partner in planning or when you're planning to start a family. Certain STIs, such as chlamydia and gonorrhea, cause infertility if not treated promptly. Screening allows couples to address potential fertility issues and explore alternative family options if necessary. It also helps promote open communication. Undergoing an STI screen before marriage encourages open and honest communication between you and your partner about your sexual health. It also fosters an environment where both individuals will feel comfortable discussing sensitive topics, leading to a better understanding and trust within your relationship. So it's very important for open communication and for you to screen, especially as a couple, before you get married. Premarital screening helps reduce stigma related to sexually transmitted infections. So routine screening helps to destigmatize STIs by normalizing the practice of getting tested. This in turn can contribute to a broader societal shift towards viewing sexually transmitted infections as common health issues that require attention rather than sources of shame. Screening for STIs also help protect your unborn babies, such as syphilis and HIV. These are infections that can be transmitted from an infected mother to their baby during pregnancy or during childbirth. So screening and appropriate medical intervention can significantly reduce the risk of mother-to-child transmission of sexually transmitted infections. And learning about your STI status before marriage can also help individuals address potential concerns and navigate any emotional challenge, knowing that both partners each other's well-being, and it fosters a supportive relationship as well. And finally, STI screening aligns with a broader public health goal by preventing the spread of these infections within our communities. Identifying and treating STI as an individual level contributes to the overall reduction of sexually transmitted infection prevalence within our society. The next test we'll talk about is your genotype test, which we simply call HB electrophoresis or sickle cell test when you walk into any lab. What this test does is to reveal whether a person is a carrier of the sickle cell gene or not. This test is a very important test, as if both partners are carriers of the sickle cell gene, then they are in a high risk of having a baby with a serious disease. So sickle cell disease is an inherited blood disorder. It is marked by a flawed hemoglobin. Hemoglobin is basically the protein in your red blood cells that carry oxygen to the tissues. So in sickle cell, because the red blood cell has lost its normal shape. It's in the form of a sickle shape. The cells tend to die early, leaving a shortage of healthy red blood cells, which causes sickle cell anemia. And sometimes they cause blockage. And this blockage leads to severe pains, which sickle cell patients typically experience during their crisis. So this picture shows how a normal red blood cell is supposed to look like. Yeah. And this is how an abnormal red blood cell, a sickled red blood cell, will look like. And you could see how the sickled cells have blocked this blood vessel. And this results in severe pain, which sickle cell patients usually experience during their crisis. There's also a genetic condition called hemophilia. This is basically an inherited bleeding disorder in which blood does not clot properly. This hemophilia is as a result of you having low amounts of some certain types of clotting factors in your body. This is the factor 8 and the factor 9. So we have a healthy red blood cell here, as I shown earlier, and a typically sickled red blood cell. And sickle cells blocking blood flow. You can see here how they've all clogged together and they have blocked this vessel, which usually results in pain. But then if the cells are normal, they are able to flow freely, unrestrictedly through your blood vessels. So in this picture, it shows a male and a female. So you have a male who is probably a carrier of the sickle cell gene and a female who is also a carrier of the sickle cell gene. In this picture, you see that you have 50%, 25% chances of having a child who is fully affected by the sickle cell. And you have 50% of having probably an AS child. So assuming the father is AS and the mother is AS, there's a 25% child of having an SS. There's a 50% child of having an AS and also a 25% chance of having AA. But then generally it's advisable for AS couple not to get married. So this genotype compatibility chart generally talks about both partners, partner 1 and the partner 2. Either of them can be the male or a female. So we can see here a partner who is a male who is AA and the female AA. They are okay, they are compatible, they can get married. If one is AA and the other is AS, it's okay, they can get married. If one is AA and one is AC, AC is also a genotype. It's a bit rare, it's not as common as the other genotypes, but then it exists, they are there. So if you have one that is AA and another one that is AC, they can also get married. But then if you have one SS partner, the only partner they can get married to is AA. They can't get married to any other kind of genotype. And the list continues. So this chart is available on the internet. You can always go and refer. But then if you also need it, you can contact me for me to send it to you. So finally, we are going to speak about fertility testing. Apart from checking your blood group, checking your sickle cell status, testing for STIs, it might be also important to check if you are fertile. But then if having children is not a major concern to you, you can skip this part. But then if it's something that you and your partner have discussed and you plan to do, I think it's necessary for you to undergo fertility testing. But then it's optional. This test is done to ascertain the fertility of couples, that is you and your partner. More often, a couple is unaware that they have fertility problems until 2 or more years into their marriage, because within that period, they'll have tried severally to get pregnant, but it will have been unsuccessful. So the test is really important as fertility issues can be concluded earlier without going through any form of social or emotional trauma related to barrenness. Fertility test typically includes a semen analysis for men to assess for male fertility and tests for ovulation in women. Fertility is prevalent and almost maybe 1 in 5 people suffer from fertility issues. Infertility may cause unnecessary psychological, social, biological, or emotional trauma. So to avoid any such occurrence, you must go for a fertility checkup and ask your future partner also to do the same if having children is very important to you. Encouraging joint responsibility for family planning, because at the end of the day, both of you have a joint responsibility to know your fertility status and to plan your family as well. So when we talk of infertility in women, the reasons why you might not be getting pregnant may be as a result of the female not ovulating, the male being infertile as a result of your age. There might be blocked fallopian tubes, endometriosis, that's a condition which is particular in females. There might also be underlying medical conditions. Fertility tests for men and women. Basically, when we are doing a fertility test, there are 2 samples we might take in a laboratory. We might check your urine, or there are other blood tests we could test. In the urine, what we are basically testing for your FSH levels, your LH levels. This is actually done to check whether you've ovulated or not. There are also self-assessment tests whereby you as a woman, you check your cervical fluid. And there's also measuring your basal body temperature, because usually during your ovulation period, your temperature goes slightly up than normal. And also check your cervical position, which is usually done through an ultrasound. The blood tests we do are pap smear, and it could also be check for your anti-Mullerian hormone. That's a blood test. You could also check for your follicle-stimulating hormone, your estradiol. There you could do an ultrasound. You could do a biopsy. There are also genetic tests that are done, but those are more complex tests and they are done at the advanced level. So when we are checking fertility for men, the test that is commonly done is the semen analysis. When semen analysis is done, what we are basically testing for in the laboratory is we check the volume of the semen produced by the man. We'd also check the appearance of the semen produced. We'll also check the pH, the acidity or alkalinity of the semen produced. We'll also count the number of sperms produced. We check for its motility, whether the sperms are moving well. And we also check for the morphology, the shape of the sperms, whether they have big head, whether they have 2 tails. There are so many other morphological appearances we check for. When do we have to do these tests? We've spoken about all the tests. When is it essential to do the test? Basically, premarital checkup can be done anytime. However, the right time is 6 months before you get married. Not 2 days before you get married, but you give a time about 6 months before you get married, so that you prepare yourself emotionally for whichever results you might be receiving at the end of this test. It's essential to do premarital screening to avoid medically incompatible marriage, because we don't want you to be emotionally down. And at the end of the day, find out 2 days or a week before your marriage, before you realize that you are incompatible. Maybe one partner is AS and you, the other partner is also AS, and you find out that you can't get married. So it's important to screen for this test before you get married. So in conclusion, engaging in premarital screening is a proactive choice. That means it doesn't fall on one person alone. Both of you have to come together to decide that you're going to do this test. And it benefits both partners and your future family. It also fosters open communication. It prevents health complications, empowers informed decision-making, and supports family planning readiness. Seeking professional guidance during premarital screening is a responsible step that demonstrates commitment to each other's well-being. It will help reduce anxiety and contribute to a broader public health goal. Overall, premarital screening is an investment in a healthy and fulfilling future together as a couple. Thank you. I want to use this opportunity to express my gratitude for your time and attention today. And I would like to also acknowledge the valuable contributions of the references that are cited. And if you have any questions, please feel free to ask. Thank you very much.
Thank you, Dr. Akomeah. Yes, please, question time. You can raise your hand, or you can unmute. You can raise your hand and talk, or unmute and then ask your question. You can also put it in the chat box and it will be read for you. I might say that it's been very, very educative and quite informative. That's quite a rich and a detailed presentation there. Thank you so much, Dr. Akomeah.
Thank you. So please, if anyone has a question or contribution, kindly share with us.
Give them.
Michael, do you have any contribution?
Hello.
Hi.
Yeah, my name is Vincent. I would like to know if you find out if the couple do the test 6 months to the marriage and it's found out that they are medically incompatible, is the marriage is the marriage dissolved, or no? Is it postponed or whatever? I don't know. What happens?
I think that will be determined by your counselor. But then you as an individual, being medically incompatible is relative. It depends on so many factors. It could be as a result of you being HIV negative and your partner being HIV positive. As an individual, are you ready to share your life with somebody who is HIV positive? These are questions you have to answer for yourself. Are you ready to share your life with somebody who is infertile, who you know can't have children? Are you ready to, accept the person as they are, especially when it comes to some of these genetical factors? Some of them are congenital. Your partner may be born with it. They might not really have a say as to whether there was maybe a sexually transmitted infection they went to get somewhere. You understand? So some of these factors, you as an individual will have to sit down and ask yourself about whether truly you can live with them. Your marriage counselor also plays a vital role in helping you to decide. And finally, your clinician too. Medically, we also advise you as to what to do. So at the end of the day, it's relative. You can't stand on maybe one particular condition and say, oh, okay, so because of this, I'm ending the marriage. But you as an individual, you have to weigh the pros and cons and decide whether or not it's something you can live with for the rest of your life. You understand? But medically, we would advise you. But the final decision boils down on you as an individual.
Thank you.
You are welcome.
Okay, Dr. Akomeah, please, there are 2 questions in the chat box.
Okay.
Can I go ahead and read them?
I'm seeing them.
Okay, sure.
Yeah. So the first one, can sickle cell anemia be cured? Sickle cell, there's research now whereby they do bone marrow transplants. There have been success rates, but then it's not common in this part of our world. But then there's research to show that people who have sickle cell anemia have been cured. There's research to show that, but in this part of our world, it's very, very uncommon. And here, the second question is, are miscarriages caused as a result of different resources? Yes. Yes, the answer is yes. Miscarriages can be caused as a result of incompatible resource factors. As I mentioned earlier, if let's say the father is positive and the mother is negative, and the mother ends up carrying a resource positive child, there might be something called sensitization, whereby the mother develops antibodies against the negative, the positive resource, such that if subsequently the woman takes in, there might be reactions that could result in subsequent miscarriages during the pregnancy. So it's very, very essential to check your resource or to take the injection. As I told you, they say there's an injection called Rogam. These are anti-resource antibodies injection, usually given to the mother to hold the sensitization and help you give birth without any complication. Yeah. I hope I've answered your question. Emanuela.
Yes, please. I'm okay.
Hello.
Hi.
Hello.
Hello, please, is someone talking?
Yes, please. So I have this suggestion when it comes to testing for our genotypes prior to marriage.
Yeah.
So most often than not, one thing I've come to learn recently, okay, from a colleague who is doing medical laboratory is that when they go to the labs to do the test for genotype, the machines and the kind of test they do usually reports the results as A, S, and so on and so forth. But they go ahead to see every A as AA, every S as SS. So in that sense, what happens is the person could have an A, which is the dominant aspect of the gene showing itself, but is subordinated by a C or an S. So in that sense, when 2 people go to do that test and they record the first one as AA for the man, and they record an AS for the woman, and maybe they happen to give birth and the child bears SS, women begin to suffer for that mistake of the lab. And so I would want all of us to take note that aside the subtle tests they could do for a gene, there are deep tests they could also do. Okay, aside the electrophoresis to test for what the person bears, there are other deep tests they could do. So that one, I think she said they call it, I've forgotten of the name right now, but yeah, molecular genetic testing. Okay,
Molecular,
so
yes.
they are advanced levels.
Yes.
To be
Yeah.
sure that indeed this person is AA or AS. All right,
Exactly. Okay, that's very, very true. Thank you very much for that submission. There are also tests that check for the percentage of each variant of the hemoglobin you might have. So it's very, very important. Yes, that's very true. Thank you very much for that submission. Someone is asking, what is the difference between SS and AC patients? Do AC patients also suffer the same crisis as SS patients? No, the answer is no. These are two different genotypes. The answer is no. The question is from Ifia.
Shanthi.
Yes.
Dr. Akomeah, can I come in?
Yes, please, you can come in.
Okay, so hello everybody. My name is Dr. Dodu. So obviously there's a lot of difference between SS and AC. You can see that one is double S and one is A and C. So even from just seeing how it is written, they are different. Now the defective hemoglobin are S and C. For the person with the SS, both of them are defective. And so the person doesn't have any normal hemoglobin at all. The one with the AC has the A, which is the normal hemoglobin. So the AC person is better off than the one with both defective genes. So the AC person has one gene being normal and then the second one being defective. And most of the time in this kind of instance, the A will probably be more than the C. And so they end up having no issues. They go through life, they have no crisis because they have a normal gene. The same with people who are AS. Once there's an A, you are safe. There's nothing wrong. But once you get a double defective gene, that is a problem. So when you have the SC, you have the SS, those are the people who have the crisis. Anybody who has an A has no crisis. I hope I've answered the question well.
Yes. Yes. Thank you very much, Dr. Dodu. Okay. Please, any more questions?
Hello?
Hello.
Yes, I also wanted to add something. Because of the question the other gentleman asked about the 6 months, if it's 6 months to getting married and all that.
Yeah.
Usually what I advise my patients is that everybody should test for their sickness, whether you are dating or not. Do your HB genetic testing, okay? Because that is the main thing that would prevent you from getting married. And then also the STI screening. So every once in a while, you should go and do your STI screening if you are sexually active. If you are not, that's fine. But if you are, you should check the STI screening periodically, unless you know that you're being safe. The other ones, like the infertility, some people would say, oh, we would adopt, or we would do treatments and all that. So it's easier. So once you know what your HB genotype is, if you meet somebody, before it becomes that deep, before you fall so much in love that you cannot see yourself not marrying the person, you ask the person, you tell the person, I am AS, especially if you know you have a defective gene. You are AS, you are AC. You tell the person, I'm AS, I'm AC. Check yours. Let's be sure that we are compatible first before we start dating, so that it doesn't get to the point where everybody will say that, oh, and we are so much in love that we will just try and see. Because trust me, you would not want to have a marriage that has a sickle cell child. That alone will be so much strain on the marriage that a lot of times the marriage doesn't survive. The only marriages that I've seen that have survived with a sickle cell child are the people who are extremely rich, who can afford to hire nannies and people to take care of the kids when they are in crisis in the hospital and all those things. I've not seen regular families survive when they have sickle cell children. So it's in your own interest to know ahead of time before you fall so much in love that you think that, oh, you cannot do without the person. Yeah, so sickle cell, the HB genotype screening, you need to do it for yourself, and then regular STI screening would help. Thank you.
Thank you, Dr. Dodo. Someone is saying, can we summarize what has been said so far? I believe this person didn't join at the beginning. So what we are basically talking about is laboratory tests to run before getting married, before you say I do. We spoke about premarital testing, the importance of premarital testing, what we aim to achieve when we test for these conditions, these infectious conditions or genetically transmitted conditions. We spoke about blood group, we spoke about your genotype, we spoke about sexually transmitted infections. We also spoke about fertility tests. So basically that's what we are talking about. And I want to remind us once more that all these tests we've mentioned here are carried out at Ghana Canada Medical Center Laboratory. Our lab is open, our facility is open 24 hours a day. You can walk in anytime to run any of these laboratory tests. We are in February. February is the month of love. Before you say I do, before you commit yourself, kindly walk into our facility and run these tests. Thank you very much.
Thank you, Dr. Shanthi Akomeah. Yes, so like she rightly said, we run all these labs in Ghana Canada Medical Center. And as I mentioned earlier, we are at Adringano, East Legon, and our services include pediatrics, gynecology services, general medicine practice, consultation. We have a dialysis unit. We also have an internal medicine unit, ophthalmology and optometry, urology, ENT services. We have a pharmacy, and yes, we run 24/7. So anytime you walk into Ghana Canada Medical Center, you'll be taken care of. And you don't have to come around when you are sick. You can just come for your regular medical checks, and we are there to serve you 24/7. So yeah, that's about it for tonight. We've done like almost 1 hour. So if there are no more questions, we'd like to call it a day. And before we do that, or a night, if I should say, We'd like to thank all of you for taking time out of your busy schedule to join us, especially Dr. Shanthi Akomeah for this very, very deep or very educative lecture on what's the last we need to run before we say I do. And I believe that we all have our takeaways. It's been very, very educative. So thank you so much and good night. But before the good night, I would like to say that if you want to join Ghana Canada, we have a WhatsApp group called Friends of Ghana Canada Medical Center, and we update our friends on our events or webinars, outreaches. If you are interested, you can just leave your number in the chat box and we'll add you to the group. We also want to encourage you to follow us on our social media handles. We are on Instagram, TikTok, Facebook, LinkedIn. And by that, you can follow our events and then update yourself on all these important health issues. And also watch out for March events. It's going to be very, very insightful. And so, yeah, thank you so much for joining and good night.